afternoon, everybody. I'm Dr. Uzma Sultana, practicing in Elfa Women Healthcare Center. Today, I'm going to talk about preterm birth, prematurity awareness. What is preterm birth? Preterm birth is a birth before 37 weeks of pregnancy. A typical pregnancy lasts for about 40 weeks. Preterm labor, which is starting before 37 weeks of pregnancy, going into a preterm birth does not automatically mean that a woman will have a preterm birth. But preterm birth needs medical attention right away. What is the prevalence of preterm birth? India ranks number 1 across the globe. 11.1 to 16.1, approximately 1 in 10 pregnancies are preterm birth. What can be the risk factors? Like patients who can have preterm birth. Many women who have preterm births have no risk factors, but some risk factors include medical history like past preterm birth, short cervix, and then early cervical dilatation, and past procedure on the cervix and injury during a past delivery. What could be the preterm complications? The preterm complications can be like pregnancy complications can be carrying more than one fetus, vaginal bleeding, infections during pregnancies. And what are the lifestyle factors? Low pre-pregnancy weight, smoking during pregnancy, and dietary deficiencies. And other terms could be, there could be other factors also. And then there are certain warning signs of preterm labor. What could be the warning signs of preterm labor? They are the following: abdominal cramps with or without diarrhea, a change in type of vaginal discharge. It could be watery, bloody discharge, or with mucus, an increase in the amount of discharge, pelvic or lower abdominal pressure, which could be increased, and constant dull backache. The other warning sign could be regular or frequent contractions or uterine tightening, often which is painless. There could be rupture of membranes. Sometimes, many of the times, the patient comes and tells there is a trick of fluid, gushing of fluid or trickling of fluid. How is preterm labor managed? Preterm labor can be managed based on what is best for your health as well as the fetus health. If the fetus would benefit from delaying the delivery, the medications can be given to the patients to help the organs mature more quickly of the baby, reduce the risk of certain complications, attempt to delay delivery for a short period, and then medicines to maintain uterine relaxation to delay delivery, giving more time for the fetus to mature. There are certain complications of preterm birth. It could be short term or long term. Short term complications could be low birth weight, organs, breathing difficulties in the baby, and vision problems. There could be long term complications like cerebral palsy, learning disabilities, and behavioral problems in the baby. What should a patient do if they are experiencing preterm labor? If a patient is experiencing any of these signs and symptoms, do not wait until the things get worse. Please call your doctor and visit the doctor as early as possible so that things which are going to spoil could be amended as early as possible. Thank you very much.